Elisa Jenks, and I'm originally from northwest of Atlanta in a town called Canton. My parents are from New York and California, so I grew up with kind of a different culture in my home. Grew up with not a lot of money, very poor household. Kind of always grew up with assistance. Always had the mindset of consider others, but I didn't see that playing out in nursing until a little bit later. I started in college, going to other countries and seeing kind of how other people were doing. And it was when I was in Spain in my last year of college, where I was studying Romance languages, Spanish and French, that I decided to pursue nursing immediately after that. I had a vision, a dream, if you will. I saw a child and I was helping them, and I wasn't sure that that was in the mindset of nursing, but it certainly became that. And so I did the CNL program and graduated December 2010, and have been a nurse in the perinatal unit ever since.
My name is Nathan Jenks. I'm originally from Binghamton, New York. My parents did missionary work when I was a kid, so I've lived overseas in West Africa, France, and Canada as well. So I had that exposure to other cultures and languages and such, and kind of had the giving back mentality, I guess, instilled kind of early. And I think I was originally thinking along the lines of just going into healthcare for the sort of tangible results. As a kid, being exposed to so many, curable illnesses, it was like, what can we do to help?
He makes me a lot better. He is very intellectual. Not that I'm not, but he really thinks through things. He's very analytical.
She definitely has sort of a calming effect, I guess, in a way.
One of the things I will always remember he said when we were dating was, I want to make a lot of money so we can give more away. Like, so we can live off little and give away much. And that drew me to him a lot when we were dating, and so bringing him on board, it just made sense.
She's a lot more talkative than I am.
I'm the more outgoing one, and he's a little more introverted.
I know there's more, but I haven't given it a lot of thought.
The layman health fair was an amazing experience for me in nursing school. My background is Romance languages, Spanish and French, so I lived in Spain with a Spanish-speaking family for a few months and learned Spanish, and so this was kind of my area, my specialty.
I think my first thoughts were, it's 30 minutes away and it starts at 7. I want to say I went, because I think we were dating at that time. I think I went her first year, and then I had gone a few times, just of sort of a helper of the helpers, I guess you could say. I'd had that exposure before, and this year that was my community health project for the summer.
Personal experience, herniated a disc at like 28. And so it's like I'm in my 20s and I've got degenerative disc disease basically. And that comes from not taking care of your body. I wouldn't say that I was the best body mechanic or practitioner at work, but I am now, like seeing it and teaching others, knowing that I was in a similar place, not really knowing how to protect my back exactly. And then learning through the OT station how to do that while teaching others, it became more personal.
As a nursing student, you feel like you're not doing anything real yet sometimes, or you're in clinical. Well, I'm not the nurse, I'm not the primary nurse, I'm just a student. This health fair came out of Debbie Lehman, just her own idea. We need a health fair for these workers, and she made it happen. Any one of us can do that. If you just put your mind to it, and as a nurse, you understand the community, making those assessments and all the nursing process and everything, and figuring out the best way that you can intervene to bring out some better health outcomes for whatever population you're thinking of.
Me encanta que estar una enfermera porque puedo ver cambios y buenos cambios en su vida.